Thank you, Mr. Chairman. The witnesses here today represent the most important scientific institutions in our fight against the COVID-19 pandemic and other diseases, and I greatly appreciate your work and the work of countless health professionals, everything that you've done in facing down this virus and your work to save lives. Unfortunately, President Trump's early minimization of COVID-19, followed by numerous instances of pushing misinformation, eroded public confidence in these vital public health and health institutions at a time that we relied on them the most. This wasn't limited to the White House, however. In Florida, Governor DeSantis and his Surgeon General have peddled conspiracy-driven propaganda that runs counter to the consensus of every major scientific and health organization. The governor has actively discouraged public health protocols and vaccines. He's hidden data, he's withheld aid, he's put dangerous policies in place that have cost lives and have put Florida children and families at risk. So you have an enormous job to combat this misinformation and rebuild the public trust. So I'd like to hear what you all are doing to ensure that we're operating on proper science and that the public has trust in your institutions. Dr. Tabak, I'll start with you.
One of the programs that we've established is known as SEAL. It's a community engagement alliance where we do localized approach partnering with faith and community leaders, particularly in underserved communities, to address all questions about COVID, vaccines, therapeutics, et cetera. In the RECOVER trial, we are engaging patients and communities broadly, again, trying to build, work with them through trusted community voices.
Dr. Walensky, I'll ask you the same question, but I know you've undergone a very extensive review. It's been called unflinching in your examination of past mistakes by the CDC and how you improve going forward. You've done some reorganization, so how are you working on building public trust in the agency's mission?
Thank you. Yes, obviously much of some of the challenges are challenges this administration inherited. They've been long-standing challenges at the CDC, and we've taken this opportunity to learn from the challenges of the COVID-19 pandemic. That includes sharing our scientific data faster, enhancing our laboratory quality, translating that science into clear, concise communications. I do want to highlight the real importance of mis and disinformation and how it has undermined our vaccine efforts. It is the case that we anticipate vaccine rates have gone, well, we've seen vaccine rates of incoming children into kindergarten have gone down from 94% to 93% just in this last year. That's 250,000 children not coming to kindergarten with being up to date in their vaccines. We are doing a lot of work at CDC, but this is not something that CDC can do alone. It's going to take all of our agencies, it's going to take all of the government, and every single one of us has a role in mis and disinformation.
I've seen it in Florida. The vaccination rates for children are down, and I know it's a direct result of a lot of the scare tactics and misinformation. Dr. Califf, I'm going to ask you to respond for the record because I'd like to ask Dr. Walensky about the CDC's data modernization initiative. So it's so important that we aim to get to empower the agency to get better, faster, more actionable insights on public health data. But I heard from folks back in Florida and all across the country, it was so outdated. We've given the CDC funds to modernize it. I know that's just a drop in the bucket, so what are you doing to ensure that the public has the most accurate data that's up to date?
So just to give you a scope of the problem, it took us 6 months to get data use agreements to receive data during COVID-19, and it was over 100 data use agreements. So we are working through our data modernization efforts to have a singular highway through which data pass so that data from your districts can come to CDC, and then we can give it back to your district.
Not by fax machine.
No, not by fax machine. And in fact, in those districts where we've stopped using the fax machines, there are data to suggest we've saved 140 million person hours. So that we know that these highways will work, and then we can receive those data from your districts and we can give those data back to you so you can see what's happening in your districts and the districts around you, what threats might be at your front door.
So we save lives and save money at the same time. That sounds good. Thank you so much. I yield back.
Thank you.